The mission of Whittier is to provide high-quality, reliable, and accessible primary health care and support services for diverse populations to promote wellness and eliminate health and social disparities. Significant numbers of our patients present with psychosocial issues, and it is critical for us to address those issues as we focus on behavior modification and wellness. By being patient-centered, we're ensuring that we're there when the patients need us and that we have accessible services, we meet the needs of the community, that our services are culturally appropriate and provide a full continuum of wellness and preventative services that are tailored to meet the individual needs of the populations we serve.
I think that I have a different connection. I grew up across the street, actually, from here, so I really do know about their environments and the history of this community. It's patient-centered because I really focus on the big picture and how I can best serve Deborah.
I can be who I am. I can share and tell my story and feel safe, and that's the most important thing. Is Whittier Street makes me feel safe to share. The group medical visits was very important because I'm able to ask different ones with different expertise, different questions, and also just to have that group of support. There are other people within my group that hear my story and know what I feel. You know, people get amazing care here and they feel like they're part of something. You know, we want to support and empower people.
The diabetes clinic is patient-centered in a few different ways. We do assessments of patients, written assessments about what they know about diabetes and what their beliefs about diabetes are, and then we try to tailor an education program to that.
I had all these things going on, you know, the diabetes, hypertension, and I talked about it with Dr. Drews, and he would call and, you know, ask me how I was.
We, for the last 7 years, have been tracking all of our diabetic patients, and we know who's due for, you know, a list of probably 20 different exams, whether it's an eye exam or a blood glucose test.
They really made me comfortable and helped me get through it because it was really, really scary for me at first.
As we see someone year by year continuing to do well, that to a primary care provider is really rewarding.
The Healthy Weight Clinic is efficient because we use 3 different providers in one clinic visit. And the great thing about the clinic is that a family can come in and see all those people in one clinic visit, so they don't need to make 2 or 3 visits to treat the same problem.
I remember me shopping for 2X, 3X shirts, and now I can look in like mediums, and now me and my friends, we be sharing jeans because I could fit his size, he could fit mine. It just feels good.
So Taven's a busy kid. He's involved with a lot of different activities, and I think the fact that we can provide all of those 3 visits, the nutritionist, the case manager, and myself, and do them all after school, have been incredibly helpful for Taven.
I think Whittier Street has been a support in his exercise by letting him know how much exercise he needs, and then giving him a free pass to come here to exercise. I think that was a very good help.
When I get on the treadmill and I go slow at first and I see someone next to me running and someone else next to me running, I'm like, I want to be running that fast. And then I learned like I can go faster and faster as time goes by, so I'm outrunning them now, so it feels good. So I just want to keep doing it and doing it.
And I think we really have an administrative commitment, we have a clinical commitment to serving our patients in the way that's best for them, even if it's not necessarily the way that's best for us, and that's really important about where we work.
We tend to receive and are called on to work with the children that are hard to reach. The arts are just marvelous tools that go way beyond the cognitive and the language abilities, but embraces the whole child.
Whittier hasn't only helped Mason, but it taught me to learn what autism was all about, because I had no clue.
We're catching what the needs are as early as possible. Then it's more timely, it's more cost-effective. And Mason services are moving along just wonderfully at this point.
Prior to going to Whittier Street Hilton, he never drew. He showed no interest in it on everything. Now I don't have enough paper and crayons in the house.
The arts bring out our passions for life, and that leads to success. That is effective.
I would call Whittier Street one of our fabrics of our communities.
Mason wouldn't be the kid he is today if it wasn't for Whittier Street Health Center.
I couldn't have done this by myself without Whittier.
I just enjoy coming. My mother comes, my sister, my uncle, my daughter, and I've been here since I was in my 20s.
I think that one of the greatest contributions we can make to patients who use Whittier is to make sure that it continues to be there, it continues to thrive, and it continues to add the scope of services that are needed to really provide the comprehensive health care that's going to be needed for the future.